Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Hi everybody, you're listening to the Health and Wellbeing podcast from Hillbrow Health and Wellbeing and SDHC with your host, Dr Nick Harvey. The purpose of this show is to help people understand how they can help themselves or others with their health and wellbeing. Every episode, I interview an everyday expert to understand the latest evidence and advice on how to improve your own health or help others. Today, we're turning our attention to an issue that's increasingly recognised as a serious and growing public health concern: loneliness. It's something many of us will experience at some point, yet it remains widely misunderstood and often overlooked. Joining us to unpack why loneliness matters and what we can do about it is Gill Reynolds. Gill is the facilitator for the Tackling Loneliness programme, hosted by the Sussex Community Development Association, which runs a number of community-based initiatives across Sussex to support the most vulnerable members of our community. This programme is part of a wider commitment by East Sussex County Council's public health team to reduce loneliness and its serious health impacts, as laid out in the strategy Connecting People and Places, Bringing Communities Together in East Sussex. The aim is to help people feel more connected and ensure that loneliness becomes everyone's business. Well, welcome, Gill. Thanks for joining me.
Oh, thank you. It's lovely to be here.
So I'm fascinated by how you've ended up in this role. It feels to me like such an important role, but equally quite an unusual role, isn't it? So tell me a little bit more about your background and how you've ended up here.
Well, over the last few decades, I've been working in health and social care in various types of roles, supporting people who I would say are most vulnerable to feeling lonely. So young people, young parents, young people who are not in employment or education or have got caught up in the criminal justice system, supporting people to stay independent in their own homes, having a voice, providing advocacy services so that people get their needs met on their terms, and better housing, improved benefits and access to connections within their local communities so that they can socialise and meet with other people, that sort of thing. So I realised I've actually, all the work that I've been doing, the kind of roles I've been over the last, quite some time now, it's all linked to loneliness. And what I've discovered since being in this role in the last year or so is that everything connects to loneliness. And everyone can feel lonely at any time in their lives.
Mm-hmm. And you mentioned that almost looking back, you realised you'd entered quite a lonely period, but not that you'd necessarily noticed that.
Yeah, so I became a primary carer for my mother. A few years ago, and it was a very privileged role, such a marvellous person, and so I was able to actually live with her, move to Bristol, move away from Brighton, Sussex, to Bristol to live with her, so I could really sort of be the best that I could be. And I had a remote working job, so I was able to do that. But I recognise, looking back, being a carer is quite a lonely place because I didn't really want to leave her too often. I wasn't really too bothered about going out to socialise. My focus was really about having the best time with her. So going to, nature, garden walks and going to the coast, trips, and obviously connecting her with local support, with like film club or church lunches. And that's the thing, that was my dedication to that. But after she died, I lost my identity. I've lost my place. Not only I was going through bereavement, the job had gone by then, and my home, I had to shift back to Brighton. And it was only really once I took on this role, I just realised, it wasn't just bereavement. I had just fallen into a very deep chasm of loneliness, and it really impacted on my self-confidence. But becoming more aware of my loneliness, I've been able to address that and make some changes in my life, which make things a lot better.
Thank you for sharing that. It's funny, isn't it? A lot of us, I think, don't want to admit necessarily we're lonely. You mentioned before, there's a bit of a stigma to that. And I suppose maybe what I'm hearing you say is it's useful to start to ask ourselves questions if we're feeling a bit empty or a bit sad. Could it be to do with like a connection with other people?
Yes. And what we've recognised in delivering our Tackling Loneliness programs, that people don't like to talk about loneliness. They don't like to use the word loneliness. It's not just, and this includes practitioners, frontline practitioners, community nurses or social prescribers. Some say, well, we do mention the word now and again, but it's not explicit. So within the kind of data and assessments, very rarely are people actually asking the direct question to patients, clients, have you been feeling lonely, and are you lonely? And what we've discovered is because it seems to still have a stigma, very negative attachment, that you're admitting like it's somehow you failed. And that's something that we want to break. We want to change, and we're starting to change that.
And I guess our attention's creeping up on it, because I think loneliness, despite being a very digitally connected world, and maybe not despite it, but because of it, I think, it's being almost labelled as this silent epidemic, isn't it?
Absolutely. I mean, there's lots of reasons that loneliness has become, as you've just referred to it, as the silent epidemic, particularly over the last couple of decades. A lot of people assume that COVID created the loneliness, but it's been there for quite some time. But obviously, in the last decade or so, around, you mentioned social media, but the idea of like what we call contactless living it gives cause for concern. For the more the human is kind of exercised from daily transitions, isn't it more inevitable that we'll feel more lonely? I'm thinking about, the closure of banks and expectations to go online banking, the closure of post offices for that connection, of that weekly connection for somebody that might have been a lifeline to them. So those shifts and those changes have created more lonely communities, more lonely people.
And listening to you talk, everything's gone online, isn't it? We shop on Amazon, we use mobile app, and we even communicate more and more by text rather than face to face, don't we?
Absolutely. And there's also the working from home.
Yeah.
And it's surprising that a lot of people still work from home all the time. And what we've been running is our Loneliness Matters workshops, and some interesting feedback around that lone working at home and not going out and meeting up with other people, not going into an office space or an environment, has created feelings of loneliness for those individuals who are only connecting online. We've been encouraging in-person meetings through our loneliness, our Tackling Loneliness program as much as possible, so we recognise the value of that. But people aren't so used to it, and it costs more money, or we can't afford the lunch. And I think these things are really important to recognise. Eating together, talking together in person is really important.
Yeah. I think it's probably around building some habits, isn't it? Because a lot of the things that we do, certainly I do, often the things that are good for me in the long run around loneliness, or even keeping fit, in the short term, it feels difficult, doesn't it? But actually in the long term, it's good for us. And I think loneliness is probably no different.
Yes, it is. And I think we were always talking about our mental health, and our physical health, but what about our social health? That's something that we're really trying to bring to the fore as well. Our social health is really important. Our connections with others, really important. But also, loneliness isn't just about not being connected to other people. It's also about not having a voice, not being listened to, not being heard, not being understood, and feeling not connected to the powers that be. So the politics comes into loneliness as well, where people don't feel that they have any power over what's going on in their local community. And that's so important, that people are given an opportunity to talk about what they need and what they want, whether it's the change in the environment, closing down a supermarket, or changes in the local park, accessibility to green open spaces. All these things are so important for people to feel less lonely and more connected with others.
Feeling listened to and understood, I just heard you say. Yeah, that's an unusual thing these days, isn't it?
Yeah. I think that's what advocacy services are very important. Advocacy support and that kind of approach, and what we call it a culture of deep listening, leaning in, and less of an assessment of an individual to talk, but just finding out a guided conversation. What gives you joy? What gives you pleasure? What were your interests? And then to build up, from that, rather than looking at the deficits or what's the problem, what's wrong. Look at what could be going better. That's the kind of approach that, we recognise is really valuable, especially when somebody who's become chronically lonely. They need more support and more encouragement, because there's a lot of loss of their own low moods, self-confidence, and it isn't a quick fix like join a social group and get out the house. It takes a different type of approach.
I love that. So rather than what's wrong, what gives you joy? What's good, and where can you follow? What's positive? Thank you. And typically, loneliness, we often think of the elderly, don't we? But that's not quite right.
Absolutely not. So, recent evidence research that it's only in the last few weeks it's come out that actually the loneliest people in our communities across the UK are young people. 16 to 24-year-olds are the youngest, are the loneliest people in our communities now. So I used to say, well, the young people are overtaking older people on the inside lane of loneliness, but it's actually happened, and it's true. That's the case. Yeah.
And so why does it matter? Obviously, it matters because we don't want people to feel lonely and feel sad, but it's bigger than that, isn't it? What you mentioned impacts on health. Can you expand on that?
Well, the impact on health, it's quite insidious. Some people say, well, what comes first, loneliness or, a mental health problem? So let's say depression and anxiety. And we recognise they're quite bi-directional. So feeling lonely, you can lose your self-confidence, you're feeling low mood, negative thoughts, not wanting to reach out to people, which leads to feeling disconnected with others, anxiety, depression, negative perception of yourself and others. So there's this so we do recognise that loneliness and mental health are very much interlinked, but it's the impact on, it's stopping people going that downward spiral of loneliness into chronic loneliness. And once they're in that zone of chronic loneliness, it's much harder to get out. So what we want is interventions to stop that downward spiral and interventions and connections to stop someone going down into chronic loneliness. The impacts, the evidence also suggests it's very clear of an increase of risk of coronary heart disease, of stroke, of dying sooner and earlier death, and also a clinical dementia. So for those percentage-wise, if you're chronically lonely, you've got a higher risk of earlier death by 30%, coronary disease by 39%, dementia by 44%, and higher risk of stroke by 42%. It's very stark, isn't it? And it also affects the ability to sleep and appetite. Obviously, those are linked to mental health as well. And it also decreases your immune system. So within our Loneliness Matters workshops, try to describe, well, people obviously say, well, why? What is, and I'm not medically minded, so I've done the research, and I'm not going to it's the changes with the, I can never say the word,
amygdala.
Yes, that's the one. Well, how I've described it, I said, well, imagine your body's a car, and you're driving in first gear from Eastbourne all the way to Hastings in first gear. How are you going to feel when you get to Hastings? And everyone says, oh, exhausted, oh, very stressed, that's the lonely body. That's what the lonely body feels.
Absolutely. I mean, we've evolved for hundreds of thousands of years, haven't we, as tribal people? And I think there are chemical changes that happen in our bodies and our brains that essentially stress reactions, aren't there? And without that, those human interconnections, we get raised levels of inflammation in our body, and that can cause all sorts of havoc. It's amazing, isn't it? But it's so simple.
It is. And I think that's that's kind of on the medical side of how it. So if somebody is to, approach their GP and say, I'm feeling lonely, that should be taken very seriously and recognise the value of things like social prescribing as useful to connect people to someone who's going to support them to have a better connection with local community support services and things that they may need to better connect with other people.
Tell me a bit more about social prescribing then.
Okay, well, social prescribing has been going for about, 12, 15 years. And in Brighton and Hove, it really took shape, and it's run by, in Brighton and Hove Together Co. are an organisation where they say that, it's not just about befriending, but it's tackling loneliness. So social prescribing is, somebody could go to their GP and say, I'm feeling a bit low, bit anxious, not sleeping very well. And instead of prescribing medication, taking the medical model route, there's an option of a social prescription. And often there's somebody called a community navigator or a community connector or a social prescriber connected to that surgery, who will then go and see that person and find out what they want, their joy, what their interests are, and then link them into those activities or social groups or befriending, whatever that individual needs to essentially support them to feel less lonely. So it's very much linked to tackling loneliness.
Thank you. So it's funny, isn't it? Because I guess that's degraded over the years. We used to live much more closely as families and communities. Maybe church going was more common. So that was kind of ingrained in everyday life. And it feels like social prescribing is kind of coming back to those roots and start to, okay, so you as a person, what are you going to benefit most from, and what would fit you in terms of connecting you back into the things that give you joy?
Absolutely. And it's very person-centred, so it's based on for the individual and what they needed. But you're absolutely right, the changes with housing and nice neighbours and communities, with rows of houses where everyone knew each other on the streets. Even the high-rise blocks, people would know each other, but the shifts and changes over the decades have actually broken down that sense of community. But on the plus side, there are pockets of real sort of connection and good neighbourliness. Across East Sussex, you've got some good neighbour schemes and some volunteers who phone people in their local community to check how they are. There's some real sort of positive activities, and there's lots of different types of community groups and organisations that are small but very significant. So faith groups are really important. There's lots going on with the various churches and faith groups that provide support, not just to the local sort of parishioners, but also the local community. Anybody can join. And they're really helpful as well, is connecting people with each other.
So if somebody listening is really lonely or knows somebody who they're concerned is really lonely, what sort of advice would you give then in terms of next steps?
Be kind. Just be kind, to have those conversations. Don't have to interview people about being lonely. It's just kind of checking in and saying hello. And if you can have a longer conversation and be curious. If it's someone you don't know that well, but stay curious to see if you can make that connection and persevere. And if you are, it depends on where you live, that you could check out what is going on in your local community. You can find things online. I would also recommend, if someone's listening and thinking, well, what can I do to get myself doing something? Volunteering is a really, really good idea, because there's so many different types of volunteering roles. There's something for everyone. And volunteering definitely tackles loneliness for the volunteer themselves, because they get connected to others. They're part of a tribe, a team, working with others, supporting other people to be less lonely. There could be a role that's very much connected to a befriending role or connecting with others. So is a double win around tackling loneliness. Online, there's lots of support services and local community groups in someone's local area, ideally. If someone is feeling very quiet, the GP can be a good place if that's possible, because there could be a social prescribing service in someone's area, and they could connect to a social prescribing service where they get extra support. And that could be something that somebody could suggest to someone, but check in first that because the social prescribing services, although there's a lot of them across the East Sussex, well, the whole of Sussex, they're patchy. So there are some places where they're not happening, just to let people know.
Right. So I guess if they're going to search online, is there any particular things you could search for locally?
I think it depends on where you live. There's different SCIS, which I can't, East Sussex Community Information. That's what that tells you about all the different types of community groups are.
So we can put a link to it on our website to that.
Yeah, there's also Tribe, and that gives you lots of different types of roles across Sussex for volunteering, and that's another link you could possibly give for people to look at volunteering opportunities. But just and I'd say go to if you do have notice boards in your local shop and even supermarkets, have a look, be curious, look out for things, talk to people, ask people things about where would I go to find this support or kind of connection, or what's going on, and pick up, maybe read that leaflet if it comes through the door about what's going on. I think that's start to be curious and look out there. Yeah. And
you mentioned the GP as well, and I suppose, of course, don't want to bypass the fact that often people aren't realising they're lonely. So just the fact of, if you're going to the GP with lots of physical symptoms, it's okay to ask the question, isn't it? Could this be loneliness? Could this be me needing more connections? That would
be very good. And what we've really, it's so important to start to break down the stigma and feel confident about asking somebody, have you been feeling lonely? Or do you feel you've been feeling lonely? And not disguise it around using the phrase social isolation. Social isolation is very different from loneliness. Social isolation is an objective. It's a number of connections. Loneliness is a very subjective feeling about. It's linked to the quality and the quantity of the relationships that you have, compared to what you would like. And so it doesn't mean you have to have lots of different relationships with lots of different people, and it has to be the numbers. It's about the quality, and it's what you want as an individual. And also back to the thing about having a voice and feeling heard and listened to is really important as well.
It is fascinating. You're just making me think about the quality of relationships, because you meet people who are even very lonely within the context of a seemingly happy marriage and family around, isn't it? So it is about paying attention to those close connections, I suppose, and being okay to open up and say, I'm feeling lonely. Is a good alarm bell, isn't it, for something not quite right that you can address?
Yeah, you're absolutely right. So we often say that you can go to a wedding with 200 people and feel very lonely, and loneliness does exist within relationships and marriages and households with lots of other people, but it is about the shame and the fear that conspire to stop people talking about loneliness and saying, I'm feeling lonely. So yes, it's almost like self-perpetuating that stops people reaching out for help. But what we want, it's so important to recognise loneliness in yourself and others, and help them to sort of, say, I've been feeling quite lonely.
And the timing of this podcast is not planned, but quite good, isn't it? Because is it National Loneliness Week?
It is indeed, and it's next week. It's from the 9th to the 15th of June, and there's lots of activities going on across East Sussex. A lot's going on in Eastbourne, which I'll describe. So there's some things that are happening, public-facing activities that have been run by Compass Arts, and that's happening in the Beacon Centre. And then there's some activities in the town as well. But the theme for tackling for Loneliness Awareness Week is actually helping to break down the stigma, so that people can say, talk about loneliness with each other and recognise that, it's nothing to be ashamed of. It's a human condition. Everyone will feel lonely at some times in their lives, but some more than others for various reasons, because of the demographic or the situation, or going through a life transition, as I described earlier, whether it's loss of a loved one, a pet, loss of a home, loss of a job, a shift, leaving school, moving areas, that there are transitions in life which can create those pockets of loneliness. Make people more vulnerable to loneliness as well.
So the theme, around reducing stigma and tackling loneliness together, isn't it, is the clear theme this year, by the sounds of it.
Yeah.
I've been trying to listen out for kind of a takeaway message, and you must have something on your mind, but I like to try and second guess it. Listening to you, it feels like the take-home message should be, ask yourself, could you be lonely? And ask other people, but also focus on where the joy can come from.
That's it. Simple as I think that's the thing. It's like, change the narrative about loneliness. Don't be ashamed to talk about loneliness with yourself, with others. And then, be curious around what gives me joy, what gives me pleasure, what's missing, how can I get that back, whether it was a beloved hobby. Or in my case, it was like, oh gosh, I hadn't been in touch with that friend for a long time. Reach out. I made a kind of a list, like a little chart, and I plotted people that I hadn't been in touch with for ages, and some like just cousins and not just family, but friends. And then I made the effort to get in touch, and that really helped for me. So it's just those small steps. And I must admit, I still find it difficult myself sometimes to say I've been really lonely, because it's a hard thing for people to hear.
It feels like admitting fault, doesn't it?
Yeah.
But actually, I must say, I'm slowly getting better and better at just saying, this is how I feel. And what we naturally often do is hide that feeling and kind of say, this is what you're thinking, which is often that somebody doesn't like you or something like that, isn't it? And that's very rarely the case, isn't it? And actually, if you dig deeper and go, well, actually, I accept this is how I feel, that I feel sad or lonely or left out, you can then tackle the problem rather than jumping to accusations, which is where I'd often reach to be honest.
And also solutions. So that it's not about quick solutions. And also sort of reach out to listeners, say self-compassion, be kind to yourself. It's all about, recognizing, it's been a tough time. You have fallen, it's understandable that you're feeling particularly lonely and have been for some time. But that's the other thing that seems so important about loneliness, is recognizing it and then doing something about it, taking action. And that's how a lot of support service for young people is actually, it's helpful for young people to realise they're lonely, because once they realise they're lonely, they might do something about it, and this is what they can do. So it's taking action.
Thank you so much. It's been really enjoyable talking with you and enlightening, and I'm certainly going to take away the message to try and think day to day about how I can help us as a community, and what contribution I take in tackling loneliness together. Thank you very much.
Thank you. It's been a pleasure.
You've been listening to the Health and Wellbeing podcast, where today's focus was on why loneliness matters, how it affects our mental health and physical well-being, who it impacts most, and what can be done to tackle it, with Gill Reynolds and me, Dr Nick Harvey. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Please take a moment to subscribe to help support us in empowering others with their health and well-being.